Hello, I'm Dr. Alan Bartham, and today I'd like to talk to you about functional neurology, functional nutrition, and metabolic testing for the treatment of vertigo, dizziness, and balance disorders. Again, I'm Dr. Alan Bartham. You need to understand all chronic conditions have some common threads. Conditions like vertigo, type 2 diabetes, thyroid conditions, fibromyalgia, Alzheimer's, depression, dementia, migraine headaches, attention deficit disorder, all have some common threads. And these common threads are that every one of these disorders has two major problems. One is a metabolic disorder and the other one is a neurologic disorder. This means your metabolism and your nervous system are not functioning properly, and they will have some kind of a negative effect on your body depending on your genetic triggers, and these conditions are the end result. Vertigo and balance disorders are neurologic and metabolic problems. The vertigo balance disorders are essentially an inappropriate perception of motion, usually spinning, but not always. Many times it's accompanied by ringing in the ears, but the patient has a problem with their balance and they have a tendency of starting to fall. And it's due to a problem in the central or peripheral vestibular system. Now, your central vestibular system is part of the brain that receives information from the peripheral vestibular system telling us two things: where our body is in its environment and movement, especially of the head and neck. It's made up of your brainstem, your cerebellum, the lower part of the brain, and the parietal lobes of the upper part of the brain. Your peripheral vestibular system receptors send information pertaining to where we are at in our environment and motion to the central vestibular system. This is made up of the inner ear, cervical spinal joints, and our vision. Now, this is a diagram of the inner ear, and the problems in the peripheral vestibular system come from that. 60% of all these vertigo problems do come from the inner ear. Now, Epley's maneuver is an excellent exercise for the treatment of these inner ear disorders causing problems with our balance. It's also followed up, or should be followed up, by rehabilitation of the cerebellum and removal of all metabolic problems that are occurring with this. Now, the problems in your peripheral vestibular system can include cervical spinal subluxation. That's misalignments in your upper spine causing pressure on the nerves and the brainstem, leading to problems in the cerebellum. It also leads to inappropriate input from the joints to the brain, and the treatment is chiropractic manipulation and cerebellar rehabilitation. Now, other problems in your peripheral vestibular system can be Meniere's disease, which is an autoimmune disorder, which we treat many of these conditions, autoimmunities, infections in the vestibular mechanisms, changes in the pressure of the fluid in the body, or in the ear, and tumors, and peripheral neuropathy. Peripheral neuropathy is huge. Peripheral neuropathy is when the peripheral nerves in the hands and the feet, especially feet, are not functioning right anymore. Many times because the circulation in the legs and hands is not good anymore, and the nerves start to dysfunction. And people that have peripheral neuropathy, their feet can no longer send signals to the brain telling the brain what's going on. With balance mechanisms, there's a very dramatic connection between your feet and your brain and your balance mechanism. These are all things that need to be looked at. Many people that come to me with vestibular disorders, or what the doctors have diagnosed as that, are actually peripheral neuropathy problems. We got to fix the feet before we can fix the brain. Now, the problems in the central vestibular system are composed of two things: cerebellar problems and parietal lobe problems. The cerebellum, parietal lobe problems are caused by inappropriate information from the inner ear or the neck, and underlying metabolic disorders as well. Now, your metabolism is nothing more than the food you eat and how your body turns it into the energy it needs to operate every day. Your nervous system is comprised of only about 2 or 3% of the entire body weight, but it uses about 30% of the energy that you put in every day, so it operates. It's that metabolically active. The metabolic problems causing cerebellar and brain fatigue problems: poor blood sugar, anemias, not enough oxygen. Your brain requires a lot of oxygen. Of all the oxygen your body uses every day, your brain uses 20% of it. Inflammation is very, very important. Inflammation is the bad boy with almost all these chronic conditions. Inflammation is the underlying problem, and you've got to find the cause. What does medicine do for this? Corticosteroids. To knock the inflammation out turns the immune system off. Inflammation goes down, but they're not getting to the cause of the problem, and what we're doing is working on the cause. Also, heavy metal toxicities, mineral and vitamin deficiencies, infections in the gut, leaky gut syndromes, hormone imbalances, thyroid dysfunctions, and poor digestion. How do you know if you have any of those problems? Proper testing. Testing is so important, and most often you're having a lot of tests done. The doctors are always looking at your ears, and it may be a metabolic disorder. You've got to look at everything to get to the cause of the problem, not just masking the symptoms with drugs. And if you've had the test run and your doctor says all they're normal, then why are you still sick? Why you still have vestibular problems? Because they're not looking at the right stuff. And the tests they run frequently are using lab values. The labs tell them what is normal and abnormal by comparing you to everybody else and using a bell curve average. What we use are the functional or optimal lab values for humans, and they're very much set in stone, and they're far more accurate and sensitive to reveal the problems we're looking for. This is why lab tests that are normal according to your doctor but still make you feel sick, because their lab ranges are too wide and the ones we use are much tighter. All right? So if they're telling you that you don't have a blood sugar problem and you're running 109 blood sugar, it means you've got a blood sugar problem developing, where in the functional ranges 109 you'd be classified as diabetic. Now, based on the history, we may run a number of tests and look at functional values. We do complete blood chemistries, organic acid urine tests, food sensitivity tests. These are really important. Hormone testing, amino acid testing, fatty acids, viral testing, leaky gut testing. These are all important. Remember, the metabolism affects the nervous system and vice versa. Vertigo and balance disorders are neurologic and metabolic problems, and both areas need to be addressed for the patient to completely recover. It's as simple as that. Other symptoms of vertigo, dizziness, and balance disorders are visual impairments, poor depth perception, light sensitivities. I see this with seniors all the time. They're driving in the cars and they get these giant sunglasses on because they can't have any light coming in at all from the sides. Headaches, loss of memory, fullness in the ears, vomiting because of the dizziness, loss of coordination. They're also dropping things a lot. Spatial disorientations, anxiety, heart palpitations, constipation. Guess what? That's all controlled by your nervous system. Sleeping disorders, they're not sleeping well. They go to bed and get to sleep right away, and they wake up through the middle of the night and can't get back to sleep, or can't get to sleep in the first place. A lot of headaches, a lot of neck problems, a lot of irritable bowel syndromes go along with these. So what can be done about this? Well, functional neurology is what we do with this. It's brain-based therapy. We don't just treat you metabolically, but we treat you neurologically as well. And it's not with drugs, okay? You got to find the areas of the brain that are weak or not being stimulated properly and correct them, okay? Some years ago, they found out that your brain had the ability of correcting itself, and it's called neuroplasticity. And we used to think many decades ago that whatever damage you had into a brain, that was it, and you were stuck with it. We now know that the brain can repair itself and heal. Now, this is a diagram of a nerve cell, all right? And the neuroplasticity is what we do to make the nerves start to work properly again. They quit working, and if you give a nerve what it needs to survive, it will start working again, all right? If you don't use these things, the nerves in your brain are a lot like your muscles. If you don't use them, they quit working, they don't fire anymore, and then the brain misfires. What we look for are soft lesions. Your medical doctors will do CT scans and MRIs. They're looking for hard lesions, growth, tumors. And in vascular disorders, what we're looking for is the problem in frequency of firing of these nerves. So the key component for a nerve to survive requires two major things. Fuel, that is comprised of glucose, nutrition, and oxygen. And a lot of you seniors have real problems with getting oxygen up there. You're not moving enough, you're not getting enough oxygen up there. You need to exercise. We need to get the oxygen back in your system. And activation, which is what exercise is. We also have to make sure there's not a lot of inflammation and that your body's operating with the proper neurotransmitters in it. Also, we have to talk about decreased output of your cerebellum. With vertigo, it's often mistaken for inner ear problems, and it may be a neck or back problem. Loss of coordination, loss of input to the brain. If your body's not sending signals to the brain cannot operate properly, because the signals from the body are what stimulate the brain to fire. And if you're not moving, you're not getting the activation of the brain, and it won't work. And that's important with the cerebellum. Now, how do the MDs treat these conditions? Medications, like they treat everything else. This is the problem with internal medicine in this country, is the fact that everything is treated with a drug. And the drugs are not designed to create a curative effect. They're suppressing symptoms. But then you got to take those drugs for the rest of your life. The average senior in this country at the age of 75 is taking 12 drugs a day. And this is why we have our healthcare crisis and the cost. Because nobody's getting to the root cause of these problems and fixing them, or at least reversing. They're just suppressing symptoms with drugs. With brain-based therapy, we can determine with functional neurologic exam if a weak cerebellum is the cause of your disorder, or the vertigo or balance disorder. Then we apply oxygen and the proper nutrition and stimulation to the weak part of the cerebellum to make it strong so it fires properly again. Your cerebellum, which is the lower part of the brain, controls your balance and coordinated movements. It also receives input from the inner ear by the way of the vestibular nerve. If your cerebellum is weak, you will lose balance and you will be dizzy. Now, why is oxygen so important? Because your brain is highly metabolically active and it needs incredibly good nutrition and oxygen for it to fire and work properly. We can exercise it all day long, but if it's not getting the good nutrition, the fuel and the oxygen that it needs, it will not operate properly. As we age, our ability to deliver oxygen decreases, and as a result, we need to get you working more and breathing more oxygen. Many of you slouch so badly that you don't get proper chest expansion anymore, and therefore you don't inhale as much oxygen as deeply. Now, therapies used for brain activation are many times visual. We have checkerboard patterns, colors, eye exercises are huge with this office, and we have you breathing oxygen the whole time we're doing this. And other therapies we use, sometimes we have patients doing physical therapy, upper body ergometers, and look, this lady right here's got is breathing oxygen. Exercise with oxygen therapy, EWAT. Now with functional medicine, along with the functional neurology, we are going to base our lab findings and use nutritional products that we dispense to support the biomechanical pathways for healing. Also, this is also good for the gut, the thyroid and adrenals, liver, anemia, sugar regulation, and autoimmune regulation. What makes our office different from every other is that we treat our patients neurologically and metabolically. We will leave no stone unturned to get this resolved for you. It takes time and it's a lot of work, but it's a difference between being on drugs that will actually make you sicker in the long run, because we're treating symptoms, not the cause of the problem, and getting to the cause of the condition itself. So, neurologic breakdown with metabolic complications. It's like a big pizza pie that's been all cut up and the pieces are strewn all over, and each one of these has a responsibility. And we keep testing and treating until ultimately all the pieces come together and you're a whole person again. This is what it's all about. So what's next? Well, if you came to our office for care for this condition, we would sit you down and have a very long consultation. We would also give you a complete neurologic evaluation and reviewing labs of your previous doctors. Sometimes if you bring us labs, we can prevent overlap in billing and as a result save you some money. And use some of the labs your doctor brings in because our analysis of the labs are different. We also have forms that you'll fill out. One's called a metabolic assessment form and the other one's a neurotransmitter assessment form. And you must bring a spouse or a significant other with you because there's so much information you're going to hear, you won't be able to absorb all of it. Then we have you come back in a day or two after I've been able to put all the information together, and I will review the case with you. We'll go over all the testing that needs to be done, the results of the testing you've got so far, the review of the neurologic findings from the exam, overview of treatment plan, and a review of financial obligations. And you, again, must be with your spouse or significant other. So what do you need for your first appointment? Well, if you're coming in for the examination, I want you to bring a t-shirt and shorts, because we need that so we can examine you. But what I mostly need from you is your undivided attention and your willingness to change some lifestyle issues so you get better. Now, what we like people to do is call and make an appointment for a free consultation, sit and talk with us, and we'll go over all of this very thoroughly. Then we can make, if you're still interested, we'll have you make the appointment and we'll set things up for the initial examination. All right? Now, there's 3 rules of acceptance with a case like this. You must be willing to make some serious lifestyle changes. You know, if you're eating a quart of ice cream a day, we're not going to be able to help you. you've got to make the choices and the changes. If you're eating garbage for breakfast and you don't cook anymore and you're eating processed foods all the time, you need to change those things. And if you're not willing to do that, please let us know in advance, because we don't want you wasting our time and your money. Now, insurance and Medicare only pays a very small portion for this, because this is outside normal medical realm. But we've made care plans affordable so that 96% of all the people that come to see us can get the care they need. All right? I only accept 5 new vertigo patients per month because they take a lot of time and a lot of work. So I want you to be serious about what you're doing here. And I need a committed patient, otherwise we're just wasting time. Now, on a scale of 1 to 10, how serious is your illness? These don't go away on their own. It only gets worse. Ultimately, your balance mechanisms get so bad you won't walk anymore. You're going to sit in a wheelchair. When that happens, the party's over, because of the fact that when you're not walking, your heart's not getting exercised, and the next thing you know, you have all kinds of other health issues as well, which ends up shortening your life. Anyway, my name is Dr. Alan Barthen. Thank you for listening to this. My number is 847-639-0010. Please give us a call, make an appointment for consultation. We'd love to hear from you. Thank you. Bye-bye.